Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna answer a question that patient and healthcare providers ask me. Is dry needling effective treatment for pain, or does dry needling effective treatment for pain? And I will answer this question through the study that has been done on dry needling. So I'm gonna go over 4 literature reviews and meta-analysis and systematic reviews studies to answer these questions. And then at the end of this video, we'll go over alternative options that work based on the studies. So what is dry needling? So you can see it in this image. There is a couple of different ways of applying dry needling. One is just using the needle itself, and the other approach is connecting electric stimulation to the needle. And when you look at the syringe, you can see the dry needling is very, very small size compared to the syringe. Most of patients will not feel much, but you might feel pain and bruises from the needle itself. So we're going to go over several of the claims for the dry needling treatment, and then we'll answer why these claims are not valid claims based on the studies. So the first claim is it treats myofascial pain, which relieves fascia restrictions. And I will go over the study that reviewed the efficacy of the dry needling for myofascial pain. And at the end of the video, actually, I will explain the fascia system, so it will make sense why dry needle are not effective, because it's not going to exert mechanical force on the fascia system. When we understand the fascia system, it will make a lot of sense why dry needle will not be a treatment of choice for myofascial pain. The other claim is trigger points release, and we'll go over the study that explain why it doesn't work for trigger point release, relieving pain, decrease inflammation, and they combine that with the electrical stimulation to hopefully decrease the inflammation, but there's hard evidence to support that claim too. And at the end, the most important part that everybody cares about is, does the dry needling improve function activities, which actually at the end of the day for patient, who cares if there is something happen, but at the end of the day, if you cannot move your arm, or if you're still in pain, if it does not change the quality of your life, so it seems that might not be working. So first study we're reviewing here, they looked at the dry needling. This is a literature review for the clinical applications, and what they have found, there is a small but no significant effect of the dry needling for improving functional outcome, which mean if you are a patient, you have issue with walking or standing or lifting your arm, and after the treatment you're able to do that motion, that's considered function outcome when they compare to no treatment or sham needling. So the long-term benefit of the dry needling is actually lacking supporting evidence, and here's a link for the study. Okay, the second study is they looked at dry needling in subject with musculoskeletal trigger points. That's what we talked about in the claim here. So the claim for improving function activity and trigger points. So in this research, they looked at a lot of studies, and the studies that met their criteria are 6 studies. So they reviewed the 6 studies, and what they have found, dry needling does not have a positive effect on function, which is function activities, quality of life, depression, range of motion, or strength. So there is no improvement in patient physical ability to return back to normal, and that's based on 6 studies reviewed. So the third study, it's a meta-analysis systematic reviews, which they looked at 218 articles. The articles that met the criteria for this study 13 were included, and 8 of them that was like meta-analysis. So this is very good comprehensive study that looked at a lot of study, did the homework for us, and instead of looking at case study or one single study and review it, they did the legwork for us, the researchers here. So they looked at the effectiveness of trigger point dry needling and musculoskeletal condition by physical therapists. So what they have found, no difference in functional outcome. That's what we said. That's very important. That's what we care about, that you're able to do what you cannot do because of the pain when compared to other physical therapy treatment. Evidence of long-term benefit of dry needling currently lacking. So they're not able to find any study support the effectiveness of the function activity for patient for dry needling. Fourth study, last study, it's a systematic reviews, which they looked at a lot of studies, but the studies that actually met their criteria to review it, 3 studies. So they looked at the effectiveness of dry needling and injections for myofascial trigger point associated with plantar heel pain. So what they found, that there is limited evidence of the effectiveness of dry needling and or injection of the myofascial trigger points associated with plantar heel pain. So for someone has plantar heel pain that has myofascial pain that causing the issue, they could not find a study that supported the claim that it worked for myofascial pain. So what is the solution and why the dry needling doesn't work? We need to understand the normal healing cycle. We need to understand myofascial pain, because that's what usually causes a musculoskeletal pain. And it will make sense why the study showed those claims are discredited. And then at the end of the video, I'm gonna go over some other options that work and study supported. So our body has to go through 3 stages in order to heal. I'm gonna use external paper cut for visualization, but the same process happens internally from accident, trauma, poor posture, poor body mechanic. So the first stage of healing is inflammation, swelling, redness, the blood start to rush to that area. Second stage of healing is a proliferation stage. That's when your body starts to build the scar tissue, fascia restrictions, muscle spasm, trigger points, and that's what the purpose supposedly that the myofascial, the dry needling to work on releasing the fascia restriction and trigger points. That's the claim, and we'll go over the anatomy of the trigger points and the fascia system, and it will make a lot of sense why needle is not going to be effective to work on these issues. So if our body does not build the scar tissue, it's open wound susceptible for infection. So we need a scar tissue, we need the fascia restriction, we need trigger points so the body will heal. In perfect scenario, during the maturation stage, our body clears up everything, and that could take days, weeks, months, or years. As we get older, the process of healing decreases significantly. So when you have chronic condition, your body probably going back and forth between inflammation and proliferation, which is there is swelling and pain internally, scar tissue, fascia restriction, and trigger points. I want you to visualize what's look like when you have a scar tissue internally. So the far left image here, you can see that's a normal muscle, nice and smooth. When you start to have a micro tear from poor posture, accident, trauma, any injury that has itis, you will start to have a random tear internally like that. And your body has to build a scar tissue to glue that torn areas, that micro tear. And when that happened, it happened like very random in the tissue. And I'm focusing on the scar tissue because that's overlooked by the trigger, by the dry needling treatment, and it has significant effect on musculoskeletal issues. Our muscle should act like a rubber band, when it contract and relax, stretch like this. So when you have a scar tissue, it's like you have a knot in a rubber band, and your muscle will not stretch much. The same thing happens when you have a trigger point. So trigger point actually by definition is called contractile. By definition, it's a contractile tissue that's knotted. And typically, when patients have trigger point, it's usually more scar tissue than trigger point, and they usually have both at the same time. We have to address them at the same time. So when you have trigger point or scar tissue, it's like you have a knot in the muscle, and that will prevent your muscle from stretching much to have a full range of motion, and that could cause pain, inflammation, decrease range of motion, and actually decrease your functional ability. So when you look at the scar tissue here and you put a needle randomly around it or the trigger point, mechanically impossible to release that, because for scar tissue and trigger point to be released, you have to have mechanical force. And if you have a small tiny needle, that will not gonna exert the mechanical force. And that needle gonna get inside the body for a few millimeters. What about if your scar tissue or trigger point is deep inside your muscle, like 1/4 inch or 2.5 inches deep? What you gonna do? Mechanically impossible with the dry needle to go that deep. So if you cannot exert mechanical force on the scar tissue or trigger points, you will not be able to release it, because these are hard tissue. The trigger point, when you touch it, and the scar tissue, when you touch it, it's not. You cannot poke the knot with needle and expect it deflated. It's not a balloon, okay? So mechanically, it's impossible with the dry needle to really release the scar tissue or trigger points. So if you have a chronic myofascial pain or trigger point or muscle spasm, your body going probably between the inflammation and proliferation stage. And in order to treat those issues, you have to address the inflammation, you have to work on the scar tissue, the fascia restriction, the muscle spasm, and trigger point. So what I personally do for the inflammation, I use the Magna Heal 2. This is very strong magnetic device that when we measure it, the magnetic field was about 3 inches. So 3 inches can penetrate in the body. When you look at the needle is basically gonna get inside the body a few millimeters. They're not gonna poke it all the way down to inch or 1/2 inch in your body. So it's not gonna cause a significant physiological effect inside the body. So, and the other thing I use for inflammation, I use the pain relief cream for the best result, and that cream very absorbable in the body and has a lot of anti-inflammatory ingredients, natural ingredients to decrease inflammation. The other thing I like to do, put my patient on anti-inflammatory diet so the body will heal faster. So that's working on the inflammation, and that's what you need to do when you work on musculoskeletal issue, myofascial pain, trigger point issues, or joint inflammation. The other thing we have to work on to break the vicious cycle of inflammation and proliferation is working on the scar tissue, the fascia restriction, the trigger point, and the muscle spasm. So what I personally do, to break the scar tissue, you have to exert mechanical force. So what I use the A3 to release superficial scar tissue and to break it. That can be exerting mechanical force. The dry needling will not exert mechanical force. Even if you use electric stimulation, it's not going to be effective, because electric stimulation, based on the studies, it provides temporary pain relief. And their claim is to use electric stimulation to decrease inflammation. I could not find a study support the effectiveness of electric stimulation for decreasing the inflammation. It's just electric currents that's zapping you. So the other thing I do to release deep scar tissue, deep fascia restriction, and deep trigger points is the A5. As I mentioned to you, we have to be mechanically going deep in the body in a restricted area. With the needle that's very tiny, it's hard to really go deep inside the body to exert that mechanical force. That's why I like to use the A5 that's in the big muscles. It can go deep in the body, 2 inches, 2.5 inches. uh, to cause that internal release for the trigger point, for the fascia restrictions, and the scar tissue. So that's what I personally do to release part of the proliferation stage. The other thing that claimed is myofascia release. And I will go over the fascia system, and it will make a lot of sense why dry needle impossible to cause physiological change to the fascia system. Briefly, I will go over the fascia system here in this video. So the fascia system, it consists of two major categories, the superficial layer and the deep layer. The superficial layer wrapping the entire body. And you can see it here in this image, the white tissue, the white filament here, that's the fascial layer. And next time you go to buy a meat, you will see that white filament here, that is actually the fascial layer that's wrapping a group of muscle and individual muscles and each individual muscle fiber. To make things more complicated, but don't worry, the treatment is very simple. Each of those layers has 2 to 3 sub-layers on the top of each other, and the deep layer is divided to 4 subcategories, which is the apparatic fascia that's wrapping a group of muscle, and then we have the epimysin that's wrapping each individual muscle fiber, and then we have the premiysin wrapping a group of muscle bundles, and at the end each individual muscle fiber is wrapped with the endomysin. And that's why dry needling will impossibly release the fascia system, because it's impossible to go deep to the endomysin. It's impossible to go deep to the premiysin, the epimysin, or the apparatic fascia to exert mechanical force to release those tightness. And when you have fascia restriction, it's like you feel a band or a t-shirt wearing a t-shirt that's 2 to 3 size too small that compress on the tissue underneath it. So it's impossible to really release it, especially when it goes that deep, because you really need to have mechanical force to release it. So what I personally do is I use the A1 tool to release the superficial and apparatic fascia, and that's grip on the fascial layer to exert mechanical force. With the needle, it's hard to grip on the fascial layer to exert mechanical force. It's basically you poking it. The other thing I use to release the deep fascia release is a A5 that can go to the epimysin, premiysin, and endomysin. In my website and under this video, there is over 45 studies support the effectiveness of ASTR treatment, which including the tools and the biopsychosocial model. And the studies actually shows it provide decrease pain, increase function, improvement for patient, and it provide a long-term result. Feel free to check those studies. I will leave the link underneath those video. So what is the solution? The solution is you need to have a tools to really exert mechanical force to release the trigger points, the myofascial pain, the scar tissue, and to decrease inflammation, while implementing the other part of the biopsychosocial model that I included in other videos to really return to normal function. So, and that's conclude why the dry needling is not an effective treatment. And if you have any question or comment, leave it in the comment section below. I will answer it in a future video. We'll see you soon. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.